have the pleasure of moderating this panel, which, so first let me start with John's comment, all protocols observed. So this is a panel that's very much about the evaluation design and methods. So it might be an area you think, oh, all these evaluators are all very comfortable with. So I'm hoping that we'll have some very lively discussion and some opportunities to reflect on some of the challenges and again the trade-offs in designing evaluations that answer the questions that need answering. We're already running a little bit behind, so I'm going to be very strict with my presenters. I'm going to use my please wrap up sign fairly aggressively. After about 13 minutes, I'm going to tell you to move on. So we have 4 speakers. I'd like to refer you to the biographical notes that are available. So I won't tell you anything about them other than to remind you of their name and where they come from. So we have Deborah Rugg from the United Nations Inspection and Evaluation Division, Daniel Lobier from the Global Fund, Catherine Goodman from the London School of Hygiene and Tropical Medicine, and Elliot Stern from Lancaster University. So without taking more time, I'll ask Deborah to kick off.
Thank you.
Oh, and do you have slides that you need to show?
I have slides.
So you need to speak from the podium. So we've discovered the source of interference with Bob's slides. Okay. So I'll have to come over there to wave my sign.
You need the hook. Okay. Thank you, everyone. It's my pleasure to talk about the PEPFAR impact evaluation that we've heard so much about. And I manage the slides. Okay. The IOM evaluation of PEPFAR was mandated by the U.S. Congress to conduct an independent external evaluation of the effects of PEPFAR. It was the second such independent evaluation, though it would cover the 8 years of the initiative at that point. This one would have more a focus on actual impact. The task was to design and then conduct an impact evaluation of a complex, dynamic initiative with a wide range of supportive activities and a global reach. The evaluation was conducted over 4 years by a committee of expert volunteers and IOM staff and consultants with relevant expertise. There was an extensive planning phase followed by an intensive implementation phase. The assessment of PEPFAR's contribution to impact in the HIV response at the country level and globally was the goal and part of the inception of the initiative in since the inception of the initiative in 2003. This whole of PEPFAR assessment was comprehensive and was not an evaluation of country-specific programs, specific partners, or specific agencies. Of note, for obvious reasons, it would rely on a contribution model of effectiveness and not an attribution model of effectiveness. The first step in the process was to do an evaluability assessment. That included the interpretation of the congressional mandate to the committee and the development of the evaluation questions. Next, to conduct significant data mapping of what was available globally at the headquarters level and in the countries, and an exploration of the feasibility of various designs that we might use. Third was the selection and development of the design and the methods based on a conceptual framework and the development of a program impact pathway that you can see in this slide. This conceptual framework was simplified in order to cover the diversity of programs, to communicate to a variety of audiences, and to be something that all of the technical areas could use to organize our activity. It, as I'll take a few minutes to go through, included the various inputs into the PEPFAR initiative, the strategies and guidances that were significant, the planning that was significant in PEPFAR and remains significant as we hear to this day, a lot of modeling, looking at the evolving scientific evidence base, the considerable funding and resources, and considerable technical assistance, all going into the PEPFAR initiative. Then looking at the activities along the way, the capacity building activities, the 3 areas of prevention, treatment, and care and support, and the later activity area of addressing gender equality in the initiative. Then we looked at the simple outputs, basic outcomes, and tried to understand the impacts of PEPFAR, or as we also called the outputs proximal effects, the outcomes intermediate effects, and the impact the distal effects. The outputs that we considered to be primary were outputs such as people trained, goods and purchased and distributed, services provided, beneficiaries served, and the laws and policies that were designed and implemented. Basic outcomes for the evaluation were in the area strengthening health systems, specific service delivery areas focusing on the integration of services, the coverage, the quality, the cost, the efficiency, and the access to services, and looking at resulting changes in knowledge, attitude, behavior, and norms of the beneficiaries as well as providers. Seeking overall to respond to the mandate, we focused on some of the key impact areas that would let us comment on individual and population health impact, including psychosocial well-being, HIV incidence, HIV prevalence, morbidity, and mortality. So after the feasibility and evaluability period, we came up with a hybrid design. It was retrospective and cross-sectional in nature with some trend data and some basic time series analyses. It was different, it had different in-depth approaches in different topical areas, or what might be called nested design. It also used mixed method approach. This mixed method approach included complementary data from different data sources, both qualitative and quantitative data, that helped to balance the limitations of each other. It included quality and rigorous causal contribution analysis that was improved and conducted through a triangulation approach among the different types of data and different analyses. And when combined with the program impact pathway, the PIP framework, it provided a solid basis to help answer not just whether PEPFAR was contributing, but how and why it was or wasn't contributing. Reflections on this basic design, then, are as follows. In terms of the evaluation scope and time frame, the value of a whole of initiative approach was that its findings could be interpreted in the context of the obvious interrelatedness of all the different activities. We've long since moved beyond a time when interventions are isolated and single interventions have the effect we seek, or single entities or programs. They are necessarily interrelated and interdependent. The trade-offs were the duration of the evaluation required here, and the limited data collection and depth of analysis in any one activity area had to be limited then. We could not drill down, as it were, because of our focus at the higher whole initiative level. Thus, some advice for future options for the now mature initiative might be to be much more strategic in planning the evaluation, with design of an ongoing portfolio of external evaluations rather than this single periodic, expensive, long-term evaluation, but rather focus a portfolio that is ongoing over time, with each evaluation on a more narrow and high-priority complex area that the initiative can be completed and used in a much shorter time frame and much more specific to the users and the implementers of the evaluation. In terms of evaluation use, specifically for country programs and partner countries, much candor was achieved with the design by not identifying specific countries, which was critical to the quality and the credibility of data we collected. The trade-off, of course, was a lack of country-specific findings, which many consider the biggest weakness in the evaluation overall. Future advice on this issue might be to include activities that allow a dissemination of some of the messages that could be tailored to the countries specifically, and provide an opportunity to dialogue with countries after the evaluation so that the findings that are relevant to the countries could be better utilized without compromising the evaluation design that relied on the anonymity, the confidentiality, and allowed us to have the specific candor and credibility that we had. So I think those are the highlights I'd like to give on the design at this point. There's much more we can talk about based on the areas of your interest that we'll follow up on in the Q&A. Thank you.
Thanks very much, Deborah. I think we'll continue through, and then we'll have lots of time for questions at the end. So Daniel, can I ask you to speak next?
How do I go on to the presentation? Thank you. We wanted to focus on one of the themes from the first session, which was how we bring the evaluations into the programs, into our ongoing grants, and some of the challenges of doing that. Because our 5-year evaluation, as well as providing a one-off evaluation of the fund, was also meant to be a platform of approaches to give that focus on impact in our investments. So what I'm going to focus on a little bit, as well as measuring impact, how we're bringing it into our grants for managing our portfolio more closely on the basis of impact. Depends very much on our business model, which is a grant model. It does not have a lot of resources centrally to do evaluations. So it's got some strengths and weaknesses that I'll bring out. And there's 2 bits we've done on the right. One is instead of putting the funding in a one-off evaluation, we've put a $10 million fund into investing in some of the data systems in countries and the analysis to show impact, and then an evaluation approach, which is a more rolling, continuous form of evaluation, which was launched last year. So next slide. So I'll briefly look at the evaluation approach, measuring impact, and then managing for impact, and then this country platform of reviews which we're building into our grants, HIV, TB, malaria, and some health evaluations, and they're used for prioritising investments. There's certainly some strengths and some weaknesses of the approach which I've been asked to bring out at the end. So really the 5-year evaluation was meant to, as was mentioned in PEPFAR, there was a strong monitoring focus in initial grants, but was also meant to give that focus on impact and on evaluation in the way we program and the way we manage our investments. So first of all, it's to start, why is impact important for the Global Fund? First of all, it is in the very purpose of the fund, is to make a sustainable and significant contribution to the reduction of infections, illness and death. That's what the overall objective is looking at the fund. Its new strategy is investing for impact. So for me, half of that is impact. Half of the strategy is that focus on impact. It has some precise targets that need to be looked at. It mentions both MDG 6, 4 and 5, lives saved, infections averted. And it's a key part of the programming to invest more strategically in impact. But also it's increasingly a management focus of the grants, which was one of the aims of the 5-year evaluation, was to bring the tools, bring that focus in. So impact is looked up front in the new funding model. There's an epi stage where they have to look at the data, look at the relationship of the grant to the epidemiological trends in the country. And also performance-based funding, we've moved it from just having a rating based on services. There is also a impact rating in our grants to bring those two together. The definitions of impact, when we look at our evaluation, it's got 2 components. First of all, assessing final disease outcomes and impact. This was agreed by our technical committee. And then looking at contribution and causation along the results chain. So 2 primary questions when we look at the epi stage. First of all, has there been a change in disease mortality, morbidity, and or incidence and prevalence? And this can be positive, it can be also no impact, as in the large parts of the portfolio, and occasionally increasing trends. And has there been a change in outcomes and behaviours and coverage? And then to look at causation, have interventions, but also other competing explanations, deforestation, climate change, which can affect the results and the impacts in these situations. The key bit to this, which is why we have an investment fund for data analysis and systems, is investment in the rigorous analysis, the disaggregation of data, and including comparison groups where this is feasible. It does avoid a narrow attribution of causation to a particular program or interventions, and looks at assessing the overall impact and the burden of cases and deaths due to the 3 diseases, and the causation and contribution of the Global Fund, but also other explanations along the results chain. And our technical committee wants to get an independent but also quite a practical approach to evaluation, which can be integrated into the way we make grants and into the policy process in country. And these are the 5 principles that it's put forward. First of all, is a partner approach. So it builds on evaluation programs in countries, it builds on program reviews in countries. but ensures that there's an independent lead in these reviews. It's periodic, so it's planned, regular, independent reviews rather than a one-off evaluation. So 5 years of evaluation moving into more continuous evaluations on the cycle of the countries. It has a plausibility design, looking at both positive and negative impacts and non-program influences. And it aims to build this country platform, building on program reviews, investing in them. It's entered into agreements with WHO, with UNAIDS, with TB, malaria, to invest in these program reviews in countries. And then what came and it came from the morning session, came very clearly from our grants, is they should be practical. So it needs to come up with a few recommendations to improve our programming. So this is the approach that we've taken, is from a 5-year evaluation to this challenge of 5 years of rolling evaluations and how we integrate it into programs. There's varying quality of these program reviews, so there's certainly some strengths and weaknesses of this approach. Our technical group approved this at the end of 2012, and in 2013 we've launched all the key components of the evaluation. So these program reviews, we've supported 21 program reviews in countries, and they're now part of our new funding model, the first stage of programming in grants. Thematic reviews on cross-cutting areas have been launched, 4 of them. And then data quality assessments, because that's one of the real weaknesses in these program reviews, is the starting understanding of data quality assessments for investments. And where we can is then to build in, and this is one of the challenges I think from this morning, is to build evaluations into the business model of the fund, so it's used for management as well as measurement. So the new funding model, which we've launched, includes an epi stage on program reviews, which we've used to do our funding in Myanmar and Zimbabwe, and I'll show a little bit in Cambodia and Thailand. Some of the thematic reviews have led to new grants. So a regional artemisinin-resistant grant was based on one of the evaluations by the technical evaluation group. The grant itself is then made by the organisation, does not always reflect those findings, but it was one of the important parts. There's a strategic investment fund, because the 5-year evaluation saw that there was some lack of key data for impact across countries. So there's a separate fund that is used for that, the first example of that. And it's also used for assurance statements, for AMFM, for some of the performance issues in fragile states. We're also looking for an emergency initiative that's been proposed to deal with some of those findings. But at the core, I think that question this morning is these country program reviews, how can we use them for better programming, for better grant making? So 21 program reviews have been done. It's a partner process, so we don't do these separately. We invest through our partners in strengthening the program reviews, the analysis, the independent consultants running for them, and it's a key input to our model. Here's just 2 examples, and for us why it's important to answer those questions and to establish impact up front in our programming. This is HIV in Thailand. The grant had actually been achieving many of its programmatic targets, so it was performing quite well. But when we look at the epidemiological trends, you can see high levels of HIV among IDUs and increasing levels among MSM and the male sex workers, female sex workers, stable but not decreasing as much as you would want. And therefore you would have a programmatic performance that was good, but the epidemiology was showing limited impact. And then that was used in our programming to look at the coverage, to look at the focus of the investments, to see where they could achieve coverage to improve impact. One of the big areas was in refocusing our investments from a technical proposal into where the epidemiology was. And then quite practically, out of those impact reviews, it was aiming for some of these recommendations which were agreed with the grant and agreed with the national programme. On the geographical focus, on defining the prevention package, on matching services with those at risk, on some of the monitoring approaches, and then on the sustainability and the transfer to the national funding. So those were some of the outcomes that we were looking for in the impact reviews when we build them into grants. Similarly in Cambodia, where we've put HIV, TB and malaria reviews together, we see some common factors. In malaria, a very large decrease in malaria deaths, linked to some quite distinct investments in our portfolio. Several $100 million invested, the $5 or $10 million in some of the community workers to scale up both treatment and some of the bed net use was very closely related to this decline in malaria deaths. Similarly, TB impact and HIV, we saw recent stagnation of prevention despite quite successful high coverage of ART. And these program reviews are used to show impacts as an important part of the advocacy for the program, but also then in designing the grant. So there's strengths and weaknesses of this approach of having a more rolling evaluation building into our grants. It is one of the strengths is not just for measurement, but trying to use it into the management, into the programming, into the investment in our grants. It uses a causative framework largely on time, person and place, which has been quite powerful but has some limitations. Big variability in the quality of these program reviews. I think it will take 2 or 3 years to really bring the quality of these reviews up, but they are then useful for both the national program and for partners. Investments are needed indirectly in data quality and particularly in the analysis. And it does need some strong political backing to turn these into recommendations for the national program and for the grants, both externally and internally within our grant model to promote that focus on impact and on the epidemiology. It's just a limited approach. It works well in countries where there are additional investments in country evaluation agenda, where there are trials, there are studies, and there are operational research that is ongoing. And that has not always been the major focus of the fund. So just in conclusion, that's the one of the methodological challenges in the direction of our evaluation agenda is going from a 5-year evaluation for a more continuing 5 years rolling evaluation. The key components, I've stressed one of them are these country impact reviews, but we also have thematic reviews looking at some key themes, data quality assessments, and there will be periodic synthesis of these reports, but probably not on such a big scale as the 5-year evaluation. Very important for us was this focus that the 5-year evaluation gave on impact and establishing this external value or not of a program at the beginning. Very important for prioritizing investments. Sometimes the quite small parts of a portfolio that you may not expect in prevention and community workers, which have a large impact that need to be included. And has some management and measurement benefits. But there is still this challenge of the independence of these with our relevance to our grant management. We've set them quite close to our grant management as part of the Secretariat, so these will be used. It's very much a frontline evaluation approach in the way we're doing it. Thank you.
Thanks. Daniel, while you're there, since everyone's keeping so well to time, I wondered if you could just give a really brief summary of the methods of the reviews, because I'm sort of left thinking what takes place in these reviews, what sort of data are drawn on, and what is the sort of, what is the overall design of the reviews, so we can think about how it might compare with other ways of doing evaluation.
Well, I mean, two main things. It draws on ongoing program reviews in countries, so the aim of it is to strengthen the impact evaluation component of HIV, TB, malaria, and health reviews in countries. What it uses in terms of methodology is there's a series of questions that have been defined by a technical evaluation group, which start with impact and start with outcomes, but go along the full results chain. So those have to be built in. It then invests in an independent consultant to ensure that they are run independently, and in the analytical part, which is often upfront before we have the program review. And the final outcome of it is then 2 or 3 key recommendations for our grants and for the program. So it builds on the existing data and the evaluation in the country, but it invests a lot in the impact part and the analysis part, and in ensuring we've got an independent reviewer in the country.
Okay, thanks. All right, let's move on then to Catherine Goodman, who's going to talk about the design of the independent evaluation of the Affordable Medicines Facility for malaria.
Great, so thank you, Cara. So AMFM, as we call it for short, this evaluation was commissioned by the MFM Secretariat at the Global Fund with the advice of the TERG, put out to a competitive tender. And so there was a particular RFP that we were responding to, and then our group, the independent evaluation team, then developed that. And I'm going to show you how that developed. How do I go on? Deborah, how did you click down?
Just on the left side of the mouse.
Okay, very good. So just for those of you who aren't in the malaria mafia, I think it was called earlier, why were we doing this in the first place? So there was deemed to be a big problem with treatment for malaria, particularly access to effective antimalarials. So the recommended drugs are ACTs, but despite them being free or highly subsidized in the public sector, access was still very poor, and this was partly due to public sector failures with stockouts, and also because a lot of people use the private sector when they have fever or what they feel is malaria. In the private sector, the ACTs were way more expensive than some of the alternative drugs, which meant that many customers were buying less effective antimalarials, or some were buying artemisinin monotherapies, or some were not buying antimalarials at all and just getting painkillers. And the artemisinin monotherapies was a particular concern because particularly the oral artemisinin monotherapies are felt to potentially contribute to the development of artemisinin resistance, whereas the ACTs, it is hoped, would prevent that. So that was the problem. So the idea of AMFM arose. Its goals were, through improving access, to contribute to malaria mortality reduction and also to delay the development of resistance to artemisinin. And the objectives were increasing the availability of quality-assured ACTs, their affordability, their market share, and their use. So AMFM is definitely a complex intervention by Simon's or any of the other definitions around, but I am quite aware, listening to the terms of references of many other people in this room, that we got off quite lightly. This is, in fact, one intervention, albeit with many components, but we're talking about a rather more focused task than many of the other evaluations today. So MFM has got three elements. The first is price negotiations with ACT manufacturers to try and bring down the prices offered to the public and private sector. Then the sort of headline aspect is a buyer subsidy at the top of the global supply chain, so a really large subsidy on these drugs. And then within country, there's a range of supporting interventions to ensure effective scale-up. That could be public awareness and education, the use of this green leaf logo you see here that marked all the subsidized drugs, recommended retail prices, training and supervision, and strengthening other aspects of regulation and pharmacovigilance. And in MFM's first phase, it was implemented in these 8 different pilots, implemented at a national scale. And so that meant that once importers from these countries were approved to participate in AMFM, they could buy from approved manufacturers at this subsidized price. And then within country, the drugs were just distributed through the standard public or private sector distribution chains. So AMFM didn't have any distribution structure within the country. And it's hosted, of course, by the Global Fund in Geneva. So coming to our evaluation design, I mentioned there how once the drugs are in country, they go through the standard distribution networks. So there's not really any control over where within a country they go. This intervention operates pretty much on a national scale. So we didn't have the potential to have control areas within the country. So instead we relied on a pre- and post-test design with a baseline and endpoint assessment. And our key primary source of data were outlet surveys. To tell you a bit more about those, they're nationally represented surveys conducted at baseline and endline. The endline was 6 to 15 months after the first subsidized drugs had arrived in the country, varying by pilot. And we then surveyed all outlets that could possibly supply antimalarials, so looking at a sort of total market approach in the evaluation. So those could have been anything from public, private health facilities, pharmacies, drugstores, even general stores where they stocked antimalarials, or community health workers or itinerant vendors. Whoever had antimalarials, we visited them. And this was a survey stratified by urban and rural areas, and it was based on the sample size was based on detecting a 20 percentage point change in quality assured ACT availability. So that gave us data on ACT availability, price, and market share. But for data on use, we needed household survey information. So for the household surveys, it was decided not to fund specific household surveys for this study. I think this was largely due to cost considerations. It wasn't that use was not thought to be an important outcome, it certainly was. But it also reflected the fact that we do have these many other household surveys that are ongoing all the time, collecting data on fever treatment, such as DHS, MIS, and ACT Watch. So it was felt that those could be used. In the end, we only had appropriately timed data from those type of surveys for 5 of the 8 pilots, so the use data was somewhat incomplete. So the next component of our evaluation design is a very important one, given the plausibility nature of this evaluation without control areas. to help us understand the implementation and move towards some understanding of attribution. We had quite careful documentation of the process of AMFM implementation and the context in those countries, what was the settings and what else was going on during the time of AMFM implementation. And I'm going to talk a bit more about that in panel 4 this afternoon. And finally, some extra studies were added along the way, additional studies sort of bolted on with particular concerns that came up during the evaluation about remote areas and about the role of the logo. So one aspect Simon brought up was describing what success will look like. And this is something that was also felt to be very important by the Secretariat. They were interested in when we got the results and say there was a 10% increase in quality assured ACT market share, would that be seen as success or a really poor performance? How would we evaluate that? So once the evaluation was already up and running, they decided to set some benchmarks or metrics. And to do this, they asked another independent group from UCSF to develop recommendations for what one could reasonably expect 1 year into implementation. So they did a big review on other malaria control interventions, other social marketing products, new commercial products that had been released, and came up with a set of recommendations which our IE team operationalized. So these are just to give you an example. So for availability, they said there should be at least a 20 percentage point increase in the availability of quality assured ACTs. And the first one there for price was that the average price of the AMFM ACTs should be less than 3 times the price of the most popular antimalarial. And there are other metrics for the other key objectives. And so when we were doing the evaluation, what we were actually testing was not whether there had been a significant change over time, but whether countries had significantly exceeded the success metric, whether we could be confident that they had met these targets. So to finish, I just want to highlight some of the strengths and limitations of the evaluation. On the strength side, it did take place in all the 8 pilots for AMFM. That does give us quite a variety of contexts. The primary outlet survey data was from nationally representative surveys, and it drew on well-developed methods through ACT Watch. And we had quite careful standardization of data collection and analysis across the pilot. So although the actual data collection was done by different agencies, not by the IE team, the IE team was very involved in quality assurance throughout that. So while we didn't have controls, the plausibility was assessed using this documentation of process and context. And I've put their evaluation by a team independent from those funding and implementing AMFM, but I think the discussions this morning have been quite interesting on the nature of independence. We were independent, but of course we ourselves were funded by the Global Fund Secretariat and reporting to them and responding to their reviewers' comments in the same way that John described. So I think the situation is probably a little more complex than I've put it there. There are also a number of limitations with the evaluation. We've talked about timing a bit, and there were really tight timeframes on this evaluation. The results needed to be out by a particular Global Fund board decision, which was going to take a very important decision on the future of AMFM. So, as you've seen, some countries had well under a year of implementation before we actually went to do the endline assessment. We had to rely on the secondary household survey data for one of the key outcomes, and that was not available everywhere and not always ideal. So that was certainly a challenge. We have 8 countries, but there are only 8, so one has to be cautious in extrapolating this to very different antimalarial markets. And there are a number of areas that were really just beyond the scope of our remit, although I think some of them have proved to be of great interest to some of the reviewers of the evaluation. So particular, for instance, targeting by parasitemia status. So did the people who got the subsidized ACTs actually have malaria? Other factors such as patient adherence or the prevalence of counterfeits. So, and of course, the measurement of mortality was raised as well. So the evaluation only goes so far. And then the final one, I think, is one that proved back or caused some of the most discussion in presenting the results, was the lack of a comparator. And so it's been interesting to hear that whole issue raised this morning. As I've said, you really couldn't have comparators within the countries. So you're left with, well, could we have comparators with other countries? And I just want to finish by talking you through some of the debates we had around that issue, because that was certainly raised as a possible methodological approach. But there were quite a lot of concerns about doing that. I mean, it's so hard when you start comparing a whole country with another whole country. There are just so many big differences in context and in the implementation of other malaria control strategies, which raises the question of what are we trying to compare with? Are we trying to compare with the status quo in other countries? Are we trying to compare with other countries who have implemented other strategies, like community health workers, for instance? So it's quite difficult to know how to even go about those comparisons, even if they were valid. And then you've got to notice there's selection bias in terms of, to be an AMFM pilot, you had to fulfill certain criteria. In terms of your malaria burden, for instance, in terms of the role of your private sector being relatively large. So these are not randomly selected countries. So to find another 8 or so that match them would be very difficult. And then there's concern about contamination into other non-AMFM countries. I mean, this can be simply drugs flowing across the border as an unintended consequence, leaking into other countries. That's relatively easy to measure because you can spot those drugs. But there's also, at a whole different level, AMFM may have had a role in kind of market shaping at the global level, really increasing the demand for relatively low-cost ACTs, might have started to influence the market as a whole and costs of production, for instance. So one can't be absolutely sure what the counterfactual would have been in the absence of AMFM. And then there's really the aspect of cost. So similar outlet surveys were only available in 3 non-AMFM countries, and none of them make great comparators for various reasons. So if you're really going to have comparator countries, you've got to almost double your cost of data collection, and the sort of appetite for doing that on what's already quite a large program is generally low. So I just wanted to finish there and just to acknowledge all of those who were involved in the evaluation and to thank those who supported us. I think I can now say all protocols observed.
Great, thanks very much, Catherine. Okay, and our final speaker, we're doing really well here for time, so we're going to have plenty of time for discussion and also for you to probe the speakers on further details of what they've been presenting. So our last speaker is Elliot Stern from Lancaster.
Good morning. I feel I'm the cuckoo in the nest. I'm not from the health field, and furthermore, I'm not reporting on a single evaluation. Reporting more on a journey searching for good practice and some efforts to design evaluations in the context of natural resource management. I once thought I would keep a book. In fact, I did start keeping a book. It wasn't called What is Done in the Name of Evaluation. It was like Crimes Committed in the Name of Evaluation. And that's partly because I spend a lot of my time reviewing cases, sitting on quality assurance bodies, and helping draw up terms of reference. And what is amazing, despite all the guidance and debates and conferences like this and the investments that have taken place, is how difficult it is in truly complex areas to find good practice. So when I say difficult, I mean you can actually read major evaluations commissioned by major bodies where the evaluation question is quite absent or certainly poorly formulated. People will talk about meeting the goals of the program, which tells you very little in terms of what they're precisely trying to get at. Everybody says context is important, but it's very difficult and rare to find studies of context. Everybody acknowledges the need for explanation to answer how and why questions as well as what. There's very little systematic use of theory. There's often poor stakeholder engagement so that the construct validity has to be questioned. People recognize multiple causes in these complex programs, multiple causes with multiple effects. They still fall back on an essentially Humean design where we're looking for the single cause of the single effect. And there's general weaknesses in causal claims and in the whole sort of philosophical basis for making causal claims, and certainly a poor integration of multi-methods. So this sort of thing is the everyday meat of reviewing evaluations by bodies that come from OECD, DFID, European Union, and all sorts of other folks. The challenge, of course, is to try to do something different, and very occasionally one is involved both in running evaluations and in trying to design some. And I want to talk a little bit about experience working with a part of the CGIAR, referred to earlier today, Collaborative Group on International Agricultural Research, who work on natural resource management research, and in particular a research program on aquatic agricultural systems, which I worked on together with John Main during the last year. Within the CGIAR, there is kind of evaluation envy between the germplasm seed people, who have a very specific intervention that they can point has led to the green revolution of whenever it was, and the so-and-so increase in productivity of rice. And other folks who are doing difficult subjects like trying to deal with environmental change and husbandry and soil science, who are constantly being asked by the board, well, where are your results? Hence the interest in trying to see what kind of designs were possible with those kind of programs. These kind of programs are multi-level, multi-placed, working at the farm, landscape, regional and global levels. They combine technological innovations and participatory types of techniques, and they try to change behavior, households, institutions, markets and policies. They're very ambitious. They try to deploy research knowledge and also local tacit knowledge in forms of action research. They engage with policymakers, scientists, community partners in planning change, and they ultimately try to strengthen natural resource management in a region. So, not to look too much at the map, we're talking about very ambitious programs that will be looking at the Lake Victoria area, the Mekong Delta, the Coral Triangle, the Asian megadeltas, with millions of people in these areas whose lives are supposed to be affected by the promises made by these programs in terms of the scope of their activities. When you look at particular program goals, I'm talking specifically about the aquatic agriculture goals, they are generic and difficult to pin down. So we're talking about sustainable productivity gains for system-dependent households, improved markets and services for the poor and vulnerable, strengthened resilience and adaptive capacity, reduced gender disparities in access to and control of resources and decision-making, improvements in policy and institutions to support pro-poor, gender equitable and sustainable development. So the way these programs are formulated do not lend themselves very easily to being pinned down to, and how will you measure this in a precise fashion, although you can if you reduce it to specific activities, which you often have to do. If you do so, you have a trade-off between being able to say something about the program as opposed to being able to say something about a particular scheme in a particular area. So I want to just talk about a few of the building blocks that we tried to build in the design exercises that we undertook with the CG. Can I go back in this thing? Does this work? No. Previous. And I want to talk about the adequacy of theory and so-called theories of change, causal inference and contributory causes, the evaluation questions and program attributes, because these seem to us to be some of the most important building blocks that needed to be built into these evaluation designs. Simon earlier this morning helpfully laid out some of the different ways, logic frameworks, results, pathways, theories of change, and all these things are used. It is a very muddled and muddied field, and probably the language doesn't help. And I was observing this morning that the use of language between different people and the taken for granted assumptions about language are very specific to particular sectors. So the health sector has a very particular use of language, would not be the same, let's say, in criminal justice, or it may not be the same in energy efficiency evaluations. But when we tried to suggest what was needed to be included in their assumptions about theory and theory of change, is yes, you had to identify the critical links in program planning, implementation and delivery. Several people today have spoken quite strongly about implementation. Identify the critical conditions, assumptions and supporting factors. As I'll indicate in a moment, we're very much influenced by notions of causation that include supporting factors and contextual factors. Identify rivals to the official program theory. Big risk in many of the evaluations we looked at within the CG to have a confirmatory bias, a bias that would basically say we're looking at the way this thing is supposed to work rather than looking at other ways in which it might be working. So emphasizing finding rival theories, assessing the context of program implementation and finding ways of doing that. We try to do some of that ourselves. It isn't easy, but it can be done. Not so much by looking at individual contexts of individual activities, but rather by clustering together sets of contexts. Attempting to eliminate alternative explanations and rival theories as well as to confirm program theory. So we tried to build in those kind of principles into the design. In terms of causality, as I already indicated, we were quite influenced by thinking of people like Mackey and Ina's causality and Nancy Cartwright, notions of supports and contributions that make a difference to causal inference, because most programs don't cause results single-handedly. Rather, the intervention makes a difference or contributes to results. And that's quite a difficult debate to have in the CG, where people want to know that we did it, we made the difference, and we had the effect. So if you use the language of necessity and sufficiency, rarely is a program both necessary, i.e. the only way to achieve goals, and sufficient by itself without the support of others. So if you took a very particular fish farming example, and there are innumerable fish farming examples within this big global program, the components... Is that something I said? The components of the program would include participatory research on low-cost fish food, startup funding for farmers, provision of fingerlings, small fishes, advice on improved fish farming methods. Those things would be consistent across the board. But the supporting factors that came out from different studies that have been done, and we reanalyzed reports that have been undertaken by different researchers and consultants, the consistent supporting factors was an adequate number of initial farmers convinced that they wanted to try things, an adequate market for fish surplus, that was surplus to family consumption, and sufficient family community support for additional work that was going to be required if they were to take on fish farming. So you could tick boxes quite clearly and say that if these supporting factors were present, it was more likely that the scheme was going to be effective. So the initiative made a difference if, firstly, the expected results were achieved as a result of the initiative and its supporting factors, and the initiative was an essential, secondly, the initiative was an essential component of the causal package. The causal claim is that the package is sufficient to bring about an observed result. This is just a mini example of some of the particular attempts we made to put a logic into the designs that they were planning. Evaluation questions have implications for design choices. And I think people place insufficient emphasis on how they formulate evaluation questions. So a big difference between the questions are, can observed change be attributed to the intervention? Or did the intervention make a crucial difference? Or how has the intervention made a difference? Or will the intervention work elsewhere? Which has quite clear implications in terms of, for example, counterfactuals might work best with question one. It's difficult to explain without some kind of theoretical framing, and whether the question works elsewhere requires some in-depth understanding of context. The other major building block that I want to talk about or refer to is the attributes of programs, what this thing is, the nature of the evaluand. We did some quite in-depth analysis of the characteristics of the evaluation objects. So among the attributes that were highlighted by people in the CG was ecosystems which mediate between social and ecological systems, lack of market-based coordination. Now, if you have very complex ecosystems, it raises the question of the multidisciplinary knowledge base that you have within the team. If you have a lack of market-based coordination, you have to assume that there's going to be conflicts. and that you have to look at collective action, which has certain implications for how you conceptualize their problems. There are level-specific interventions, because this is a multi-level program, which have higher system consequences, so hence the importance of nested designs. That's been referred to several times, but the thing that struck us very strongly was it was not only the nested designs, but to establish some way of showing the connections between the different levels. If you were doing things at a farm level that was supposed to have implications for water basin management, how could you demonstrate not only that you were effective at the farm level and you were effective at the water basin level, but there was some connection between the two sets of actions? Uncertain and extended change trajectories. I'm using the term trajectories in the term that Michael Woolcock uses them, not only in terms of the extension, but also the shape of them, things that happen sooner, things that happen faster, which means that you have to design the evaluation aligning it with the stages of the trajectories. So it was very difficult for the timing of these trajectories when you had certain things that would change over decades, like landscapes, and certain things that may change in a week, like markets. So how you actually time the evaluation in relation to that changing, moving feast was an issue we tried to build in. And systems integration involves trade-offs, institutional change versus farm productivity versus environmental risks, trying to include some game theory and modeling aspects to capture trade-offs and the more holistic aspects. So the key messages that I've been trying to emphasize is not only that design is important, but if you want quality evaluations, you have to invest in it. And we actually ended up trying to suggest that up to 20% of the effort and the budget available for the evaluations ought to be invested in good design work, which doesn't just mean sitting and writing a proposal, but it does mean revisiting the design issues over time. The more complex the program, the more the design matters, and it takes time. If you get the logic of description, explanation, and causal inference right, methods follow more easily. What I'm saying there is very often when we look, when I look at, thank you. That's enough. When I look at evaluations, you find incredibly complex methods. And sometimes you have to conclude that if only the questions have been well formulated, and if only there was some clear understanding of the kinds of explanatory framework that was being expected, the methods could be the techniques and the methods could be a lot more straightforward. And that an understanding not only of the questions but of the program attributes at some depth is important in order to design these kinds of evaluations. Thanks a lot.
Okay, so thanks to all of our speakers. We are lucky to have now plenty of time for discussion and debate and suggestions and insights from the panel and from those on the floor and from those who are joining us via the web broadcast. So let me start by just summarizing. We have very different presentations. So Deborah talked about contributory designs and also the idea of evaluating a package as a whole, both kind of across countries and across program components. Daniel reminded us of how the Global Fund is trying to bring evaluation into programming, and able to use feedback from these more regular evaluations into program designs. Catherine described the design of the evaluation of the AMFM, and really, I think, pointed out the importance of describing and then about design methods as a way of understanding causes, and that goes back to the very first presentation we heard this morning, and trying to explore the extent to which the AMFM was responsible for the causes that were observed. And our final speaker talked, reminded us of the importance of linking design to the evaluation questions and of the numerous levels and mixes of evaluation methods that are available to us, but also the importance, I think, of investing early in design. So I just wanted to ask a question to a couple of the panel members, and I'd be interested in hearing your views. We heard about the importance of context, and I wonder if each speaker could speak very briefly on how they conceived of context in designing their evaluation and what sort of methodological approaches there were to understanding the effects of context, particularly in these complex interventions that are so highly dependent on context. Deborah, can I ask you to start?
Could I go last, please?
Sure. Catherine, are you willing to take a go? Since I know you have thought about this.
Yes, I'm trying to avoid scooping my next presentation in panel 4 when we're going to talk about this. But so I'll be brief. But I think we did think context would be very important. And we had developed one of these theories of change, or whatever terminology you'd like to use to look at them. And we tried to think within that of the key elements of context we could hypothesize in advance might be important. And then within the countries, we did case studies towards the end of the evaluation, qualitative and quantitative data, so specifically trying to collect data on both the sort of context of the country. So, for instance, what is your anti-malarial market like, for instance, and how has that affected how AMFM has rolled out? And also, what else has been going on here? So, if there had been a change in one of the key outcomes, is there anything else that is plausibly responsible for this apart from AMFM? So we tried to look at all of those things, mainly through qualitative and some quantitative data towards the end line.
Thanks, Catherine. Daniel, do you have any thoughts about how your country programs take context into account when doing these program impact reviews?
Sure. The point I'd like to make is on when you look at causation, and we have quite a open approach to looking at impact and causation. So it's not just related to an individual intervention or even to the Global Fund. So I think there's an early stage in these program reviews where you need to challenge the programs to look quite openly at the data, and it's a stage that's often lost to develop some of the hypotheses which could be related to changes in the epidemiology and some of the non-programs, some of the contextual ones, some of the malaria programs, not just the effects of ITNs of treatment, but also those community workers which came in seemed to be crucial. Deforestation, which was also a hypothesis that could have had some of these changes and make those comparison groups. And then secondly, when we look at impact, is often to start with impact and outcome and then work back along the causal chain so that it brings out a number of those different hypotheses of change, rather than we're starting at the other end with a single intervention or even with the Global Fund.
Okay, thank you. Elliot, I imagine that in thinking, you've probably thought rather systematically about context, because the interventions that you're looking at are also ones that are complex and taking place in environments where lots of other things are going on at the same time.
I think I tend to start more in terms of defining the unit of analysis, which inevitably means that you're drawing a boundary around what is this thing we're evaluating, irrespective of what it says in the terms of reference. You might or you might not include adjacent programs and institutions. You might or might not include the actions of some of the key actors, including the promoters of the particular program that you're working with. So I think there is an overall question of how you define the scope of the object of evaluation, which defines what is the context and what is inside, which can be quite movable. And from a kind of almost a systems theoretic point of view, you were likely to approach that in terms of quite pragmatically. And it may differ, for example, if you're doing a multinational study in different countries. In some, it may well be the behavior of government agencies. In another, it may be the climate and the roadmap, which implies that part of the design stage is to try to understand on the basis of prior research, or on the basis of key informants, or on the basis of supposed beneficiaries' understandings, what they see as being the key factors. Now that's important, firstly, for me, from the point of view of the unit of analysis, but the second side, which is important, is that if you take a kind of a realist ontology, where you're actually looking at mechanisms in context, being able to understand why things work in one place and not in another inevitably drives you towards trying to understand how is it that the context has made the difference. And so to some extent, the rediscovery of context can occur much later in the train of events. It can occur when you get to the stage that you have this puzzling data. And it may only be then that the nature of that context might be revealed, and it may be rather foolish to try to anticipate it all at the beginning, because it won't have become clear for the planning stage. So it's clear at the planning stage in terms of your need to define a unit of analysis, but at a much later stage would be when you might find the nitty-gritties that are specific to the intervention.
Those are very helpful insights, because I've often found myself sort of worrying a bit about what is the boundary between what is process and what is going on in your intervention and what is going on outside. And I think that reminder that you can define your process to include some of the other actors that are in the context is very valuable.
Yes.
Deborah.
Yes, happy to comment. In the PEPFAR evaluation, the issue of context came up in the early phases in the design, and a contextual framework was drawn, a conceptual model was drawn, embedding the PEPFAR operations in the country context of many, many other factors. And so conceptually it was understood. Then practically in the study implementation, we did look at a variety of indicators that were compared across countries to give a contextual background of how PEPFAR was operating, or the environment PEPFAR was operating in, as well as I was pretty impressed with a significant qualitative research component to the evaluation that was able to uncover qualitative contextual issues in the discussions in the countries that were visited. But what strikes me equally important, we don't talk a lot about, because it's not so theoretical or systematic, but it's in the genre of context, and it's the influence of individuals and charismatic leaders, and the power that one person has, and the incredible effect when someone who's been really critical leaves a program and programs dissolve. And certainly Carmela at the country level can talk about this, but we don't talk about that as equally important in our models. I'd be interested what Elliot thinks about that. It's not just a theoretical aspect, but it's a very powerful aspect.
Thank you. I'm very happy now to open the floor up. I'm going to try to get 2 or 3 questions that our panelists can address at a time. How do I know if there are questions being emailed? You'll signal me. Okay, fabulous. Okay, would you like to start? And can you just introduce yourself before you speak?
I'm Shangita Mukherjee from George Washington University. It was actually a specific question to follow up on this discussion, because I heard several terms being used. I heard context, I heard non-program, and I heard supporting factors. And I very much agree with what Elliot said. In my experience in trying to understand with case study, like really, how do we generalize, how do we get transferable lessons, defining the boundaries of the unit of analysis is what helps you understand what is the context, and then therefore what are the boundaries of your ability to generalize. But you all were talking about things that are non-program, things that were supporting factors. How are you thinking of these in the same way as context? I also tend to think about mediating factors, things that the project doesn't, or the program doesn't directly try to influence, but may actually be under the indirect influence of the program activities, but not part of the specific objectives. So I just sort of thinking a little bit more about the terms.
So we need some clarity on language in order to be able to communicate clearly. Does anybody in the panel want to take on some of those issues in terms of language? Think about context, mediation, non-program, supporting. Elliot, do you want to have a go?
Not really. They're very good questions, as always. I mean, I would agree that we have a language problem. I could imagine that in particular cases, you may take the same phenomena and define it as a mediating factor, and in another circumstance it wouldn't be. So, no, I don't think. I think that it would be really helpful for there to be somewhere in the evaluation community a serious activity around context, and I've been trying to suggest that for a while, that we actually need to have as a in our toolkit, if you like, ways of typologizing or evaluating or understanding the role of different aspects of context. And you've rightly pointed out that there are very different aspects. Quite different to talk about non-program things and those things that we can influence, and then the much more causative, specific contextual or supporting factors that might affect a particular change in a particular place. So I think all we're really doing here is scoping out an area that has been sorely neglected in the evaluation community, not only in the health sector, but much more widely.
Does anybody else want to add anything to that?
I might just say one provocative thing, that not all context matters.
Yep.
So it's about figuring out what really matters and is influential, I think, and figuring out what that is in the context is more what the issue is in context.
But some programs are also bounded. Not many of the programs we've been talking about today, but I can think of a number of employment-related interventions of active labour market policy in the European Union, which are bounded in the sense that they're not influenced particularly by what happens outside. They don't need to worry much about some of the nature of the environment. And then furthermore, even when they're open and embedded, sometimes aspects of that context are quite irrelevant. So all of that would be true.
And it does point to the need for some really careful analysis of cases, doesn't it? People to detect the patterns that suggest that certain elements are more important in some contexts than others. And I think that sort of foreshadows a little bit some of the discussion that we'll have this afternoon in the mixed methods and triangulation session as well. So I don't want to take too much of that away from this afternoon. Any other comments? Yeah.
Hi. I'm Carlo Carugi from the Jeff Evaluation Office. I'm going to sit at your chair this afternoon at that very panel. I have a question. One of the good practices that you suggest is stakeholder consultation, and we at the Jeff Evaluation Office very much agree with that, especially I deal with country-level evaluation. So we try to do it for information and data gaps and other stuff, starting from scoping and all along the evaluation processes. So I'd like to hear from the other panelists what level of and typology of stakeholder consultation has happened in the 3 evaluations that you have described. Thank you.
Okay, thank you. Let's see if we take 2 questions and then come back. Maybe 3. One here and then one right in the very back. Oh, sorry. We'll come back to you.
Hi, Arnab Acharya at HLSP. I have a question for Catherine and for Elliot. In my field, which is economics, we've sort of become, impact evaluation has sort of introduced a hyper empiricism in some ways, I think. What my question would be is that, Catherine, is when you're looking at the market for AMFM, there are lots of good market analysis out there. It's a bread and butter of economics. And how much of that was useful? And in my view, actually, what probably Elliot was saying was that when we're doing impact evaluation in the social context, we really do need to be very good social scientists. We need to, the stakeholder analysis or those things, I think, are still very much kind of hyper-empiricism. We need to go back to some of our theoretical models. The behavioral economics is, I think, the new behavioral economics, I think, is actually a good introduction to impact evaluation. That's being done by Thaler and Mulianathan at MIT. So I actually think that we really do need to go back to theory, social theory, sociology or economics, or whatever theory that we actually know very well. But I think impact evaluation actually has stressed more the need for theory than this hyper-empiricism that we actually have tended to move toward in the last 5 years, I think, or 10 years, I think.
Okay, thanks, Anand. Carmen?
Thank you. My question is actually for Daniel. What's the relationship between the country program reviews and the development of the investment case framework? because I think that you're looking at program reviews as a basis for the development of the new funding model. And the investment case framework is doing something very similar, but really putting the lead at for the country to decide. Thank you.
Thanks, Carla. Let's work backwards then. Daniel, do you want to take that one right away? Because that was very specific and direct.
No, it's a very good point, and the aim of it is to put these program reviews at the country level, bringing in the consultation of the partners. It uses the frameworks of the investment case where it's seen relevant at the country level. And it is a stage then in our grant making. So before they go into doing a grant is to have that EPI or program review where all the data comes together. There's consultation with the partners to strengthen the evidence base for the investment case. So not to have evaluation at the end of the cycle, 3 to 5 years, but to try and put it, as you mentioned, up front in an investment case. The type of questions that are asked now in proposals are around impact, around outcomes, around what has worked, what hasn't worked, what are the contextual factors. So that's very much the positioning of the evaluation approach that we're pushing in the next few years.
Thanks, Daniel. So Elliot and Catherine, this question about theory, about using market analysis to understand what was happening in the anti-malarial market in country. Do you want to comment on that? And then maybe Elliot on theory more generally.
Yeah, I mean, I think it's I like the term hyper-empiricism, using that. I think you're right in terms of this particular evaluation, that it was very much focused on very specific objectives and targets for those objectives. I suppose that this evaluation and this intervention didn't come from nowhere. So maybe the ideas behind the potential for a role for ACT subsidies and the selection of supporting interventions maybe comes out of a body of work on anti-malarial markets that had gone on before that. So I suppose one could refer back to some of that work in thinking about why anyone thought this might work and how it might work in the first place. So I think there was more of a role for it before, and I think now we're trying to play catch-up, thinking, my goodness, we've got all this great data and we can look at it in those ways. So for instance, to try and understand demand models better and estimate price elasticity of demand from all the data that's been collected around these interventions. So I think that is happening more now, and I agree with you, there are lots of really important questions that we could look at to link back to those theories. So, good point.
I'm finding these questions so stimulating that I'm not sure that I can respond to them in a linear or rational fashion. I'll do my best. I mean, things that I've just noted down while people were talking, that I think there is a big difference between stakeholders and sort of beneficiaries, in the sense that for stakeholders, the consultation for me is important around logistics, about data collection, around potentially subsequent use, which is quite different from getting the beneficiary's perspective, trying to elicit their tacit knowledge and their experience back to what I was referring to as construct validity before, so that you actually know what you're dealing with. Both of those things are pretty essential and vital. In terms of the hyperrealism thing, the hyperventilation. Clearly, impact evaluation in particular pushes people towards causation, and it is impossible to address issues of causation without addressing issues of theory. And it is quite remarkable how certain social scientists and certain social science disciplines go as far as they do without having a theoretical grounding. And it's always the exceptions who point this out. And there's some wonderful papers in econometrics going back to the 1960s, which point to the difficulties of data dredging and never having a theoretical framework in which to build around your understandings. That hasn't stopped generations of econometricians carrying on the same pathway. So clearly theory is absolutely central, and the difficulty is we're also talking about theory across disciplinary boundaries, and we're also talking about theory building, almost grounded theory and conceptualization within particular programs, and that is very difficult work. One of the comments that I wanted to make earlier on is that some of the work that we're talking about is very, very difficult, and it's very unusual, and it's very complicated, and it's very expensive. And I think we should be very cautious about saying, when do we need to evaluate? if we're only talking about Chris Whitty's examples of, we need to do things in some of his cases for assuring accountability purposes, we don't need to do all of these things. We're not trying to generate new knowledge. And I do think that given the expense of doing these things well, this is something that we need to be very cautious about. There's one final point I wanted to make, which is about back to context, because it came up in the last set of discussions. If you work within a kind of a comparison group kind of logic, you'll be very concerned with selection bias, and you'll be very concerned about whether the sites have been chosen in a random fashion or without biasing the potential results. In the natural resource management side, we found that there was an incredible discrepancy between what was described as a program and what was the reality on the ground. A program was a set of funding opportunities which came up now and again, which middle-level entrepreneurs grabbed and fed to their continuing activities in the field, some of which have been going on for a long while. So you use the expression things didn't come from nowhere. You actually found that people have been working 15 or 20 years with sets of communities in different parts of the world, and their line was not that this indicated bias, but that only certain types of settings were innovation ready. Sufficient amount of capacity building had been done to make it possible to plan these kinds of ambitious interventions in these places. So I do think that one very important aspect of context is the history of previous efforts and the ongoing relationships and the efforts towards capacity building as a way not of saying we won't include these people because they might bias our results, but rather to adequately target resources to places where there's a chance in hell that they're going to make a difference. And that would be another rationale for a contextual analysis at an early planning stage.
Okay, thanks, Elliot. Let's just go back to Carlo's question then about stakeholders. So you've usefully distinguished between kind of stakeholders and beneficiaries. Now, Carlo, are you interested in both or either one?
We deal with stakeholders.
Stakeholders, okay.
Of course, there are beneficiaries.
All right, okay. But stakeholders in terms of those sets of actors that have an interest in the program and in its effects.
Why don't we agree that beneficiaries
Are a stakeholder, indeed. So Deborah, do you want to start on how in the PEPFAR evaluation you engaged with stakeholders?
Yes, I'll try to, and I may call on the other PEPFAR committee members, the chair Bob Black or Patrick Kelly, to round out this. I know in terms of stakeholder consultation that the main funder of the PEPFAR evaluation was the U.S. Congress, and that they were consulted frequently, especially in the design stage, to make sure we were getting their intent clear, what we were proposing was doable, feasible based on our early assessments. That was done a lot, and there was then the periodic consultation with the public about what the study was going to involve. But Patrick or Bob, was there more than that?
That was...
She has a mic for you.
In the beginning and ongoing, but then there was the final dissemination. So after the report was finalized, then there were briefings with stakeholders. There were public events, or a number of public events, and including video cast events to involve people in other countries. So there was a fairly extensive set of activities, although I think, as was said earlier, not very much in countries, the most affected countries, which I think could have been, a desirable addition. Maybe Patrick, I think, say what else?
I should really let Kimberly represent.
I have a microphone, so I'll take the prerogative because I'm the master. I think one example I would add is that we did have kind of an operational planning phase in between the planning and the implementation, in which we conducted 2 pilot country visits. And a lot of the purpose of those pilot country visits was to get that kind of stakeholder understanding of not only how things operate, but also what it would take to make data requests, what kind of data requests were going to be feasible and timely, and then to also pilot some of our tools for our primary data collection. So I think that those 2 pilot visits which were also data collection visits, so they were dual purpose, but they were a big piece of the stakeholder engagement.
Okay, thanks, Bridget. Catherine, do you want to say something from the point of view of the AMFM? Because there was quite a substantial consultation at the end.
Mm-hmm. Yes, it does. It's a hard question to ask, as stakeholder is such a big term. I suppose what you're referring to at the end is that we did have a stakeholders meeting, and this was done after we'd produced the very first draft of the final report. A meeting was held in Nairobi that brought people together from all the different countries involved, so the teams that had collected the data and also their program managers, and they were able to debate the results with some sort of international level experts as well. And I think that was really helpful on that kind of face validity of the results, people sort of looking at what we're saying about their country and thinking about whether they'd like to add things to what's already gone in there. I think it also brought up some issues of people not feeling happy with the way the evaluation was framed for their country. So we had countries where, for instance, they have a very vast informal sector that's not really supposed to have anti-malarials, and yet they were being evaluated on a total market approach. And so there were people feeling, well, it's not fair for us, you know. And I suppose, so that was very interesting to get that feedback. I don't think those, as far as I know, those sorts of discussions didn't happen so much in the design stage. But at the design stage, on the other hand, there was a lot of stakeholder involvement from the international malaria community, who, the way the Global Fund works is that there are lots of advisory committees that support each step of the process, and lots of people trying to represent different constituencies, whether from the NGO sector or from malaria funders or technical experts from different fields. So at that stage, I think there was a lot of international input, but the country level input perhaps happened later on.
Okay, thanks, Catherine. Ruth and then John.
Thanks. Oh, whoops. Ruth Levine at the Hewlett Foundation. Just two questions. One is, one of the most often heard recommendations in the evaluation world is the importance of having an evaluation framework at the inception of a program. And I'm wondering whether, across the examples discussed, you could mention whether that was or wasn't in place, and what the consequences of that were. And then the second question is, I guess, to Elliot. If I heard you right, you mentioned early on in your talk that we see a tremendous number of evaluations that break some Evaluation 101 rules around framing the evaluation question and particular kinds of methods. And I'm wondering if there's a systematic reason for that, and if you could sort of talk a little bit about that. Is it for example, a weakness on the part of those commissioning the evaluations, inadequate money put into the evaluations, a kind of focus on what I think DFID evaluation policy refers to as symbolic evaluation? Maybe just sort of expand a little bit on that point and dig a little bit deeper about why we see that problem.
Okay, thanks, Ruth. Great question. Can you pass the mic to John? We'll take two at the same time.
Jonathan Simon from Boston University. I want to pick up on something Deborah alluded to that I would like to hear the panel address more. And that is, theories are clearly important for the plausibility of change. And good design, I think this room would agree, is essential. And we can look at processes and contexts and try to be good social scientists in doing that. But at the end of the day, social change is generated by persons, and often by a person. And in fact, I'd be very interested and that person is also a person who not only has intellect, but is driven by passion and commitment, which is even harder to measure. I'd be curious for the panel to discuss how much of the program variability that they see do they attribute to people differences, as Deborah said, and not only the charismatic one, because some of the disasters we have out there are a result of some very passionate, deeply committed people who are just wrong. So it runs in both directions. But the role of people 4 hours into this evaluation discussion, I don't think has been highlighted enough.
Okay. Is there a third question we can take at the same time? That's up there in the corner.
Sanjeev, University of Toronto. a lot of the discussion has, even discussions that have sort of raised the issues of theories of change, in my view, have not raised, for me, in my experience evaluating global health initiatives, what struck me was how incomplete our theories of change are. Even if we flag wave as evidence-based, what struck me was the fact that the panel has struggled with thinking about context, etc., among other things. The fact that we actually don't know as much about changing the world as we think we do is my take-home lesson. So my specific design question for you is, given incompleteness in our theories of change, what are design constructs that would actually help us deal with such incomplete theories of change?
Okay, 3 very challenging questions. So Ruth's question was how often is there, first question, an evaluation framework at the beginning of the program?
Can I just ask you to clarify what you mean by evaluation framework?
So what I mean is that the objectives of the program are well laid out. It gets back to George's point about evaluability, but really thinking systematically from the outset. How would we know? What would we measure? What are the monitoring data that we would seek to capture so that they can later be used for evaluation purposes? It's a very often heard recommendation. In almost every evaluation, there's some sort of comment about how, well, we could have done a better job had the evaluation been thought through, the basics of the design been thought through from the beginning.
Okay, great.
And I would say not just for the purposes of better evaluation, for the purpose of program improvement. That's the point of evaluation, right? I don't do this for evaluators. I do this for program and for program improvement, program learners. So in my experience, absolutely it makes a difference if a program, first of all, has a basic logic model of some sort of results chain, but the results chains in those log frames got too dry and too stilted, and they resulted in multi-page documents that I know I don't want to read, and nobody reads. They get done, they get put on a shelf. They aren't useful. And what we found using the impact pathway is we need something that was much more of a layman's language living document that program staff could use and buy into. And that was essential as a start. It's based on a theory of change. And that if you had that, then the next essential step was an evaluation framework or some sort of evaluation plan that was going to go along with that. And that, yes, it does make a difference when you have those two pieces together in designing and implementing more effective programming. Now, I say that largely from anecdotal experience. I think it's time we maybe need to do a study because people say, what's that based on? That assumption that if you have an evaluation framework and if you use it and you have an impact pathway of sorts, that your program is likely to be more effective. What's the evidence that supports that? And I have a lot of anecdote, but we haven't done a rigorous study. But I think maybe we should because it's such a strong finding in my experience. Should I do the others while I'm...
Sure,
okay.
Why don't you?
All right. The role of the people and the program and the influential charismatic leader and the good and the bad, bad, and the ugly. We don't study that enough, and I do think it's equally powerful to many of our theoretical components and implementation elements. And without good leadership and good management, people understanding, knowing why they do what they do, the best late intervention isn't going to have the same effects as someone who does do it and get it. And I think equally so, the evaluator needs to be looked at. And there is, I think, a growing backlash of the kinds of evaluations that have been laid on countries on different areas, that it hasn't advanced program learning in that country much at all. And so they're looking for different kind of evaluators and evaluation approaches that actually generate at the end of them useful information that's immediately applicable for program improvement. So I think we have to look at both the role of the people in the program and the evaluators and see how we systematically assess that and make some inroads on that. And the evaluation social theory and needing to do better theories of change. It's interesting to me when you train in medical school in the biologic fields, biologic plausibility, biologic theory is always there. It's always prerequisite, which then allows you to go on to do, rigorous randomized trials, but also equally make conclusions with case study N of 1. And it's because of the power of the biologic or theoretical basis to it. In social science, we have strong theories, but we have abandoned it. And I've often wondered why that is. And I think it's because a lot of the funding, our theories are complex, and a lot of the funding doesn't quite see the value of our very complex theories and doesn't fund us to fully utilize it. But I think that that needs to change, and we need to have a requisite that these theoretical bases in the social arenas are fully understood, have a funded phase, and that the dissemination then is equally funded so they can have a feedback loop for understanding how programs work and making them work better.
Thanks, But Daniel, do you want to say something about
Sure.
program theories in place at the beginning? I think you were also probably much more involved than we as evaluators were at the beginning of AMFM. So, maybe speak to that.
So, I'll talk generally about the grants, but yes, I think there are often in the proposals, there are evaluation frameworks with impact, with goals, with theories of change. The trouble is there isn't a process to then come back to them every 2 or 3 years in countries with funders. And I think that's one of the big shifts we're trying to do is from the monitoring, which is clearly important, where we've built some of the systems, to asking those evaluation questions. And yes, then that does change, for me, everything in the program. It changes the dialogue and the consultation, because instead of just asking about your own targets, you do need to bring in PEPFAR, you need to bring in other funders to understand impact outcome. It brings in context, because it will bring in a whole series of causative questions that you can then answer, and it forces them to adjust their theories of change as the program goes on. You need to do it in a very independent but an open way to allow the program to test, to improve, to ask those questions, which is why, as well as a 6-month monitoring, we try and bring in now that 2 to 3 year program review, which has got a different dialogue in it. It brings in partners, but it asks those questions. It's not just a methodology, it's asking, going back to those questions on impact and outcome, which I think does open up many of the possibilities of programming.
Do you want to take on John's question about individuals and the power of individuals in making programs work or fail? And how you would incorporate that?
They're not often the hypothesis you put into a grant. I must admit that John Smith will cause a 20% reduction in HIV, but no, there's no doubt that when you look at impact and outcome, you find unexpected causative pathways. So it's not just within the program. You can often find 5 to 10% of the funding was absolutely crucial. Many of the prevention parts, when we looked at the DRC, Democratic Republic of Congo, meant to have very little data, very little outreach in PMTCT and treatment, and yet there was a prevention component that was bringing down HIV prevalence among sex workers. It was a small part of the portfolio, but it was clearly one you then want to prioritize and build your program on. Of course, then you pick up individuals. There's no doubt in some of the prevention programs, in Uganda, actually in DRC, there's individual musicians, cultural figures that have been crucial in this that you can pick up in the timing of events. I wouldn't necessarily start with them, but I think it is opened when you ask those questions of outcome and impact, and then you work backwards to ask what has caused that. Many situations we found in our portfolio, you can't establish impact and outcome, and you can't also follow the causative framework, but it's very important to show countries where there is demonstrated impact, where there is limited or no impact, because they need to change, and then there's quite a group in the middle where it's actually unclear. And I think that's important.
Catherine.
I just wanted to pick up on the role of the individuals. I mean, I think everyone who's ever evaluated programs knows about the importance of that. And I do think, though, that there are, in the field of policy analysis, to confuse people with more different terminologies, but the field of policy analysis is really based on understanding why certain policies are selected and why they're implemented the way they are. And within that, actors is always one of the most key areas one looks at. So I think perhaps it's trying to draw in, when we're looking at documenting process and context, drawing from those other fields of social science, which really do to put them center stage amongst other key elements, and always do think about them and the role of power between different people, for instance, and how that plays out. And I mean, certainly within AMFM, I'm not sure that we tended to highlight so many particular individuals, but for instance, there was a particular group that was the Clinton Health Access Initiative that was working to support AMFM implementation in every country, and they had young, very bright, enthusiastic people who were oiling the wheels around everything, keeping everything moving. And so that, for instance, was something that came out of our work, that made it much easier to get effects quickly, whereas people could have got stuck. They were there kind of manoeuvring, helping people get round bottlenecks. So there was certainly something that we looked for in our evaluation, and with that group is just one example of where it was very important.
Okay, thanks. Elliot,
Yes,
there's a question
well,
directed to you. Why is it that Evaluation 101 rules are so frequently broken? Is it because of lack of money or weak designs?
I think there are many different reasons, but one of them would be overambitious and underfunded terms of reference, which lead to competitive bids that are unrealistic, and a collusion between the funders and the people who make the bids to say, well, you know, they've put in a really ambitious and beautiful bid that really matches. Of course, we know in our hearts that this can't be done. Then, of course, the process starts of how do you dismantle this overambitious bid in a fairly collusive way during an inception phase. That I've seen that happen quite frequently, and if that does happen, there's very little solid ground to stay on, because the solid ground that did exist has been hacked away. Another problem clearly is poor governance, where there is not an adequate governance process of an evaluation. Another thing that happens within consultancy firms, and a lot of evaluations certainly in Europe are undertaken not by academics but much more by consultancy firms, is that the big cheese turns up for the presentation meetings to start the thing off and then disappears and hands over to less mature cheeses. And as a consequence, a lot of the experience base on which the proposal was written is not necessarily present in the thing itself. So I think there are many different reasons. I just wanted to pick up briefly on Sanji's question about the issue around sort of incomplete knowledge and frameworks and understandings. It does seem to me that a lot of our thinking today has been about the big evaluation that begins at a beginning and runs for a certain time, and how do you stage it. But some of the comments made in the first panel were about having an ongoing process that was perhaps more open to what would be an iterative design process. And I do think recognizing incompleteness means you've just got to keep revisiting the design and keep upgrading it as you go along, and that may be the only way to deal with major gaps in knowledge, and to keep reviewing how far we've learned things that could make us do it differently the next time.
That's a very helpful thought. I think that's probably a very good thought on which to end, since it is lunchtime. I'd like you to join me, please, in thanking our panelists for some stimulating discussions.